So how can sinus issues contribute to sleep apnea?
Sinuses are really important in developmental format, and also it's part of your functional airway. There are several parts. It's going to be the nose, the mouth, and the back of the throat. Those are three parts of a functional airway. And you can have a problem here, you can have a problem here, or you can have a problem here. In all three spots, it's going to yield the same response, which or the result, which is obstructive sleep apnea. So the number one thing, let's start with the nose. We want the air to go through the nose to the back of the throat and down. Now, if something is obstructed in the sinuses, we're not going to be able to breathe through our nose. If that's the case, we're going to have to open our mouth to be able to breathe because we need air, right? So we've got to either find it here or we've got to find it there. Those are the only two ways we can get oxygen into our bodies. Now, if somebody has a sinus obstruction, and it can be for many reasons. One, somebody could just be born like that. Sometimes people are, if they're not breastfed for a long time, that will cause a problem. If as people have had braces and teeth extraction, it will cause this kind of problem. Thumb sucking habits will cause this kind of a problem. Even using a pacifier is going to cause sometimes, this kind of problem. And the reason why it develops is because when we're in our childhood, what actually occurs is as a baby is suckling on the breast, the sinus cavity is being built. And as the baby suckles on the breast, certain cells send a signal saying expand the palate, open up the functional airway. That entire airway is made. And that's usually when we're babies, right? It happens for, from 0 to about 2 or so. If somebody is not being breastfed, the sinus is not going to get the signal to grow and be a great open airway. The same thing happens if somebody has a thumb sucking habit. What they're going to do is make the palate like this and make their sinuses small because they're signaling the sinus to become smaller. Also, pacifier does the same kind of thing. The pacifier, again, it doesn't signal the sinus to grow as it should. And so the sinus will be a lot smaller. And sometimes it's just genetics and evolution, right? I'm sure everyone's read, Homo sapiens and really looking at evolutionarily how we're changing. When we were, 100 years ago, 200 years ago, our sinus cavities were really big and our heads were smaller. But now we're also smart. So our heads are super big and our sinus cavities are becoming smaller as we age and as we go through this evolutionarily. And this is really great because, there's a great book called Breath, and it actually goes through the evolutionary science and looking at different skulls from 2,000 years ago to skulls now and skulls a couple hundred years ago, and looking at the trend and seeing how we're evolving to have smaller sinus cavities and bigger
And
brains.
what is chronic sinusitis, and how can that help? I mean, how can that worsen your sleep apnea symptoms?
So chronic sinusitis is for any of those reasons I talked about, whether it's even simple evolution or simple genetics or not being breastfed or thumb sucking or anything or history of braces and teeth extracted, that sinus, it becomes smaller. So chronic sinusitis means it's an inflammation of. So it's being, the sinus is really inflamed and irritated. And these sinuses have actually cavities. So they're actually big old holes. They're designed to be there for our bodies to be able to filter out any toxins, filter out any junk. That's what it's designed for. So when somebody has sinusitis, that means that area is inflamed because their bodies are not able to, take away allergens, take away mold or what have you. So that sinus has been irritated for more than 6 months. Anytime we say something is chronic, it's been over 6 months that somebody's had this condition.
And then, are there any treatments or therapies that can improve your sinus health and help to reduce sleep apnea symptoms?
Absolutely. There is one of my favorite techniques, and it's called the nasocranial release, which is really awesome because you can feel the effects immediately. We actually can open up, you have three cavities. So there's the upper, the middle, and then the lower on each side. So we can actually take a small balloon and be able to inflate that interior sinus cavity. So what that does, if there's any junk or anything in there, it helps drain it out. And it helps start opening the sinus cavity so you can get good fresh air in there. And I really love doing that because you can feel the results instantaneously. That's number one. It'll also pop any bones that may not be in the right place. What it'll do is, we have a lot of different bones, especially bones that connect the front of the face to the back of the face. Sometimes they're not in the right position. Maybe somebody had a concussion, when they were younger and were playing volleyball or, they were playing football, whatever it is. So we can pop all these bones into place, which is really great. And it really allows that sinus to open up right away. There's also things over the counter. My favorite is X-Clear, which is a chemical, and it's xylitol based and hydrates a sinus and helps open it up chemically. So that's really great as well. And then the biggest way and the most fun way I like to open up sinuses is really through activating our bone making cells at the base of the sinus and at the roof of the mouth through a dental device. As we expand the upper arch, we are able to expand the sinus cavity and get it to drain in the proper place. And that is always a lot of fun. So yeah, there's several ways we can open up the sinuses non-surgically.
A lot of people get sinus infections. Can that contribute to sleep apnea as well? And then are there ways to prevent that?
Yeah, absolutely. Majority of the time, people who have sinus issues do develop sleep apnea over a period of time. And that's because their sinuses are congested. They're not able to breathe really well. They're breathing through the mouth. For example, if they gain weight, women go through it during pregnancy, hormonal changes, things like that. We talked about not having enough acetylcholine earlier, not enough vitamin Bs. That'll cause our muscles not to be as strong. So a lot of different things will cause chronic sinusitis to be present. The key is that we want to get rid of it because all it's going to do, anything with sleep apnea is going to actually obstruct a functional airway, right? And so, like I said, you can either have obstruction here, you can have obstruction here. And a lot of people with chronic sinusitis actually also have a postnasal drip. And that postnasal drip makes it almost impossible. It makes it so hard to not have things fall back in the back of the throat, which causes a lot of irritation and, more swelling of the tongue, more swelling of the oral pharynx. And it causes a lot of issues as well. So.
Should I consider maybe seeing an ear, nose, and throat doctor, in addition to, my dentist when talking about sleep apnea and sinus issues?
Absolutely. I highly encourage working with an ENT physician because they're able to actually treat polyps. Sometimes patients have polyps. Polyps are basically, it's a benign, it's not a tumor, it's tumor-like substance that actually grows in the sinus cavities, especially if somebody's been, has had mold exposure, chronic sinusitis as we're talking about, and now that body has had it so much that it's now creating extra tissue. And so an ENT would be able to surgically remove that extra polyp or that extra tissue in order for the patients to be able to breathe better through the nose. So there's always a reason to see an ENT. And I think honestly, the best way to work with an ENT is actually working with someone like me who focuses on the functional airway and with an ENT because both of our tools combined can help you make you feel better for a lifetime. Because right, we don't want you to go through like a polyp surgery and then you keep needing it. I mean, they can help you with the polyp surgery. They can clean that out. Now I can expand your sinuses non-surgically and get you breathing really well through the nose, maybe use some ozone therapy and things like that to induce healing. And then both work together and now you're happy for a lifetime.